Broadcast is now starting. All attendees are in listen-only mode.
Good morning. If you could hear me, you can type in good morning, Liliana, Diana. We just want to make sure that everyone can hear us. Awesome, Memo. Thank you so much. If you are here for the Justice Involved Collaborative, you are in the right place. Thank you so much for joining us today. We have quite a webinar planned for you all, as well as our roundtable for you all to be able to ask questions. My name is Liliana Villanueva, and I will be co-hosting with one of my favorite colleagues, Diana. Diana, will you like to introduce yourself?
Thank you, Liliana. This is Deanna Simon. I'm one of the regional outreach coordinators on the community partner outreach team. And I'm here with a whole team of us that are here to support you. So I'll let Liliana manage the introductions and pass it back to you.
Of course, we have our wonderful policy team and our team from our JI team from the call center here with us. If you all would like to start, one of my favorite people of all time is Beth. If you want to start and introduce yourself, Beth.
Hey everyone, I'm Beth Fishel. I am the HSS4 for the VEC Central Processing Unit, and my team handles the corrections 5503 email box, which is now called the Justice Involved 5509 email box, but we'll touch more on that later. So glad to be here.
Thank you, Beth. And another one of my favorite policy people, Christy.
Thank you. I'm Christy Taylor. I'm with Medical Eligibility Policy and do a lot of work to help support the community partner processes.
And I think we're also joined by other amazing favorite policy people. Janelle, would you like to introduce yourself?
Hi, I'm Janelle White. I am a medical policy analyst for aging and people with disabilities.
And last but never least, Greg, would you like to introduce yourself?
Hello, I'm Greg Prince. I'm operations manager for the centralized processing unit who handles the Justice Involved 5509 email box.
Awesome. Thank you, Greg. This is our wonderful team behind the JI Justice Involved Collaborative. They are here to answer any questions you may have or to hear any concerns or themes that are coming up within your region with working with the Justice Involved. We also have a wonderful guest speaker, and we will wait to introduce her in the following slides. We just wanted to wish you a happy 2022. This is our first collaborative of the year, first Justice Involved collaborative of 2022, and we're hoping to start out the year strong and have wonderful collaboratives from here on with some great topics to bring to you all, as well as for you all to bring us feedback and things that are happening in your counties and in your regions. Today, we will be using Poll Everywhere quite a bit. If Poll Everywhere does not work for you, it is okay for you to use the chat box. We are looking for 100% participation. We're going to just start up with an icebreaker or check-in question just to make sure everyone's able to use Poll Everywhere. I'm going to do a little tutorial. Let's see if y'all can see it. Give me a second. Okay, can everyone see? Yes. So in the, I'm gonna put this in the chat box. Everyone has it, so everyone can follow me. So if you type in or cut and paste and put polleverywhere.com/Oliververa795 and click on it, you should get this page. And it should start with, what are you looking forward to in 2022? I am looking forward. Can you see, Diana, can you see the, okay. For, what am I looking for? For more JI collabs.
I thought you were going to say more travel.
Oh, true. I love traveling. So can everyone see the process? I want to make sure that we get as many people on Poll Everywhere as possible, and you'll know why soon. We really want to make sure to make this particular webinar as interactive as possible. Diana, do you have anything else to share while we wait for people to jump on?
I'm on the phone with somebody who's trying to get connected, so I'm going to let you lead
Okay.
and I'll text you when I'm back.
Okay. Awesome. So we have quite a bit of people. So as you can see, this is the word cloud. So it shows all of the words that you all are using or comments that you're putting into the Poll Everywhere. So put it, type into the chat box if you're having trouble with Poll Everywhere. If you're not able to get on, totally fine. We will just make sure to capture your feedback through the chat box. I'm having trouble. Okay, so the person having trouble, just type into the chat box and we will make sure to capture it. All right, well, thank you so much. So now we have, I think, most of you all on Poll Everywhere. Okay, all right, so we're gonna move forward. So for today's agenda, the objective today, we're gonna welcome our guest speaker, and we're gonna go through an email update. We're gonna talk about the Medicaid incarceration process project, the 115 Medicaid waiver. We're gonna do Poll Everywhere questions, and we are gonna end with a round table for you all to be able to ask and provide ask questions and provide us with feedback that you may have. So starting this month, January 22nd, your corrections email, the corrections inbox will change. So previously the correction email was corrections 5503. Now it will be changed to Justice Involved 5509. So the older email will have an auto forward to the new inbox for 3 months before it's fully retired. Please update your contacts. So make sure if you need to email the Justice Involved email box that you are aware of the changes. We'll send this up into, yes, I will put it into the chat box. But we will make sure to send the slides so you have this as well. And I will make sure to add this to the chat box. Or Diana, if you can add it to the chat box, that'd be great. So I have the pleasure of introducing our guest speaker. Katie, would you like to introduce yourself?
Sure, yes, thank you for having me. My name is Katie Beck and I'm a Senior Operations and Policy Analyst with OHA. I am focusing on our more vulnerable populations that move throughout our system and where there are areas of opportunity to make improvements or develop programs that will meet the needs of the people we serve.
Thank you.
So I am here today to talk to you about a couple of bodies of work that we have going on where there's some intersections with the work that the Justice Involved community partners do. So one of those is a Medicaid incarceration process project. We are collaborating with our partners who touch the current state of our processes that impact OHP eligibility, CCO enrollment, and access to care as individuals are entering and exiting incarceration settings. This body of work is looking to ensure a seamless process that promotes timely access to health coverage and treatment for recently incarcerated individuals. A byproduct of this is to help reduce recidivism rates through improved health outcomes and stability. The second goal of this body of work, as with should be everything that we do, is ensuring our compliance with CMS so that we can continue to operate programs on behalf of Oregonians that we serve. The other body of work is the Medicaid demonstration waiver. So OHA is in the process of developing an application to the federal government that requests federal authority to use Medicaid funding in ways that will bolster supports for our justice-involved populations. And when we're talking about the justice-involved populations, we're talking about, in this context for this section of the waiver, we're talking about the Department of Corrections. And the program that we're requesting federal authority, expenditure authority, is for development of a 90-day pre-release OHP eligibility program that establishes a care coordination service. So when an individual is ready to walk out the door of a Department of Corrections setting, they are walking out the door with the social determinants of health supports that they need in place, whether that's housing, food, education, vocational training, as well as whatever their assessments show that they need, if it's mental health services, if it's substance use disorder services. We want to make sure that we're cutting out the delay that currently exists for these individuals as they're leaving a Department of Corrections setting, and they're able to access services and supports immediately. The other population that we're requesting some federal authorities for is county and local correctional facilities. So what we're requesting with this is a continuation of OHP eligibility for the duration of incarceration in these settings, as well as development of a social determinants of health benefit package for these populations. So what I want to stress with this is that we are at a stage where we're developing our application to the federal government, and we will be moving through a series of steps once we submit our application. Sorry, hang on one second. Sorry about that. Working from home is very humbling sometimes. So in terms of the phases of work, we're developing our application for CMS and intend to submit that mid-February. Once we submit that, CMS will do a public comment period that'll last about a month. And then after that point, we'll begin our state government to federal government negotiations and development of standard terms and conditions. We don't anticipate that will be completed until November. So in the interim, we're going to continue to work through the operational planning so that we're not losing ground on time. But I wanted to provide some context so that you understand that this isn't an immediate program, that it's a long-term planning happening here. So as we're doing this development for implementation planning, it's important that we hear from the experts that are doing the work on what's occurring in reality, and where the areas of opportunity and barriers are. I think it's easy for me to make speculations, but my exposure is not the same as yours. So I really want to have an open dialogue with you all and learn from your experiences and what you're seeing in your day-to-day work that will help us develop and implement programs that really truly meet the needs of the individual. You can go forward.
So we have some poll, like I mentioned previously, we are going to have some poll questions. So give you a chance. Hopefully everyone is connected still into Poll Everywhere. I will put again the Poll Everywhere link in the chat box. But we're going to start with our first poll question. Katie, if you want to read it out loud.
Sure. So this is intended to be the first in a ongoing conversation with you all as we develop these programs. So maybe before I jump into the first question, I should ask: are there questions around what it is that we're here to talk about today?
And if you have questions, you can type it into the chat box. I can also unmute you if you would like. Is there any questions you all may have about what Katie, the project that Katie is talking about today? And Deanna, do you want to handle the questions?
Yes, absolutely. Sorry, I'm also trying to help somebody get in still, but I will do that. Thanks for the heads up.
Okay. Well, I'll go ahead and start moving through the other questions that we have to talk about, and I invite Deanna or well, anybody to interrupt me if you have a question about the waiver or the incarceration process project. So what is the experience for incarcerated individuals who need substance use disorder treatment while incarcerated? Are there observations that you all have made, or experiences that you've witnessed while somebody is actually in the jail? Thank you for that. Yeah. Oh, that's interesting. Where is the in-facility medical or medication assisted treatment at?
And the person that wrote that comment can type it into the chat box.
Perfect. Thank you.
I'd like to add something from the questions box right now, which is they cannot get assessed in jail for substance abuse disorder because they don't have insurance while they're incarcerated, and they can't afford to pay, it sounds like, for that assessment. And sometimes we want them to go straight from jail to inpatient treatment, but they can't do that without an assessment, and they need to get that assessment before they're released and they're admitted. Thank you for sharing that.
Yes, thank you. Is it safe to say that assessments are not consistently being done by individual jails?
It sounds like that's true for at least 2 areas based on the chat, but quite possibly more.
Yeah, sounds about right. Thank you.
And yet some counties, it sounds like, do contract with outside providers to do assessments while individuals are still incarcerated. So it sounds like it is spotty and not consistent around the state. And that is precisely the kind of information we're looking for here, because sometimes we just don't know what we don't know.
Exactly. And then I have a question for Liliana about the functionality of this. When this is over, Will you be able to send me a copy of all of the responses that are being put into the text box?
Oh yes, I have. This is why we wanted to use Poll Everywhere, because it gives us a wonderful report that's very easy to read.
Fantastic. Thank you. If we move on to the next question, will people still be able to enter in on the first? I don't want to cut off the response.
No, we'll go. It'll go back. If we move to the next question, it will go to the next question.
Okay.
Yeah. Diana, do we have anything in the chat box?
Yeah, we have a question that I'm not sure is in scope to answer right now, and we have another comment. So I'm going to start with the comment, which is the difference between incarceration and in custody. So for one of our partners, the term incarceration means a person is in prison, but in custody is used when a person is in jail. I don't know if that's consistent throughout, but it's good to call out that we may not be having the same definition. I know that I'm not sure I've been clear about, I've mixed those up and have not,
Sure.
they've not been specific for me. So
I appreciate that. Language is so nuanced and important. Thank you for calling that out. So I'm operating based off of the CMS definition of incarceration. So somebody that is a resident of a public institution is being considered when I'm speaking about incarceration. So it sounds like when I'm using incarceration, I'm using it as both incarcerated and adults in custody. Does that help?
And then, because I want to move to the next question. Diana, is there another comment or question?
thank you, there is. And the question is, and Katie, I'll let you either answer this or not answer it at your discretion. But the question is, under the waiver provision, if it is approved, with continued health care while either in custody or incarcerated, will the adults in custody be able to get to appointments outside of the jail? So if they have this limited benefit package or some sort of ability to get services covered by Medicaid, will they be able to go to appointments outside the jail with proper deputy escort?
Sure. So that is that we're going to have to work through during the implementation planning. There are, as I'm sure you know better than I do, there's a lot of complexity around transporting somebody outside of the jail setting. So I don't have a good answer at this point to say that that is definitely highlighted in our implementation planning. What we would love to, we want to make sure is also realistic.
All right, I'm gonna move us to the next question.
Perfect. So our next question, what is the experience for incarcerated individuals who need to access substance use disorder treatment as they release to the community? And I think some of those were, some of the responses from the last question apply to this, particularly where there is a assessments happening prior to release.
And I just typed in something from the questions box into the Poll Everywhere so that it's in there, because it was from previously, and I thought it was I wanted to make sure it.
Sure. Thank you.
It's showing up. And I'll continue to try to do that.
Muted.
Thank you so much. We really appreciate you all providing all this feedback. It's hard to read all of the comments, so apologies for the quiet time in the webinar, but we want to make sure we capture all your feedback. And again, if you're not able to use Poll Everywhere, just type it into the chat box. Or if you would like to unmute yourself and tell us, that's also an option. Just let us know.
I'd also just say that some of these comments are really prompting more questions for me that I would love to have conversation about. So please note that I view this as a first conversation in what I hope will be a series.
Deanna, do we have any comments in the chat box?
Unmuted.
Trying to read them right now, so I'm sorry. And I'm going to read this in case it prompts any other input. In Clackamas County, we have the assessments completed while in jail. Complete their OHP application on paper, then complete it in one on the day of release. And they are transported by a mentor or probation or parole officer from jail to treatment. So I'm hearing that some of the local facilities are finding ways around the transportation challenges, but that those transportation challenges still exist. And that, I believe, is our only comment right now that we haven't already covered.
Okay.
Except to say, I will add one more thing, I'm sorry, and it's really about Multnomah County and possibly other counties who maybe have an outside provider who comes in to do those evaluations in order to get somebody into treatment, that even if there's a relationship there, it doesn't mean they're able to handle all of the cases. So even when there is that workaround or that relationship, there are still gaps.
Yeah.
I'm gonna move us to our next question. And if you have more to provide on this question, please add to the chat box and we'll make sure that this is added to all of the feedback.
I will read one more thing that just came in, which is that the 7100 form to unsuspend benefits, if it's marked urgent, typically does get processed within hours, meaning the person will get their coverage restored within hours. And our treatment providers are aware of that. So what I'm hearing from that is that the process for sending in an urgent 7100 for immediate SUD treatment is working. So if I heard that wrong, Michelle, please correct us. But I wanted to share that in case anybody has a same or a different experience they'd like to chime in on.
The next question, what are the primary barriers to incarcerated individuals releasing with substance use disorder needs? I'm seeing a lot of responses around the Medicaid eligibility timing and out of area releases.
And if you choose E, if you would like to tell us a little bit more about what other is so that we can capture all of you all's feedback, and we may not have everything that may be the barriers for individuals. So if you are part of that 15% that is choosing other, please let us know in the chat box what you mean by other, so that we capture all of this information.
So far, we have 2 votes for the other being the lack of beds available. No treatment beds available. Here's another comment that I will read. out of area release makes the cycle of CCO enrollment timing and then open card access and Medicaid eligibility challenging, presumably. That's a challenge, that the out of area release and the CCO enrollment piece is difficult to coordinate.
Okay.
Which we might want to speak to, Katie, because that came from kind of Northeast Oregon, and I'm curious as to where the concept of getting locked onto OpenCard and having OpenCard pay for the duration of that treatment stay plays into that, and if that's helpful or if that's not helpful. But maybe we can come back to that at the end. So Vixen, I would really encourage you to ask more about that in our roundtable, so we can speak to it. And I'm reading a couple other comments to make sure I can express them. I have a question here. I think it's a question. I would like to know how they get their stuff done within hours. And maybe, Steve, you're referring to the corrections email team. I'm not sure. I'd like to know how they get their stuff done within hours. I've never had that happen for me. I struggle to get them back onto benefits. Steve, if you can say a little bit more about what your question is or what the barrier is or what you've discovered that's helpful, that would be terrific.
Could we also just articulate if that's with a full application or if it's with the 7100 form?
Thank you. So Steve, a little more elaboration so we can really speak to it. I have another comment here in the questions box. Specifically, one person refusing to give me their patient OHP ID or even telling me if they were approved or denied for coverage. Sometimes patients call the jail telling me they were told their benefits were not on. So somebody not having their OHP ID or knowing if they have coverage. And Kelby, maybe if you can say a little bit more about that. I don't know if you're able to look them up in MMIS to see if they have coverage. I would, the SUD treatment facility in theory can also do that. So maybe if you can elaborate on the challenge you're experiencing there. Here's another one. In our area, if they are on OpenCard, they cannot get their medication. I will bring that up during the roundtable. Thank you, Vixen.
Yes, I would like to hear more about that.
Yes. And there are quite a few more, so I'm going to keep going down here. A client is trying on their own to find treatment with no knowledge or help from anyone. Yes, oof. I'm sure hopefully they can find a community partner who can help them navigate. Here's a positive comment here. Somebody is sending in a 7100 form around release at 9 a.m., marking it urgent, and it is being addressed by noontime. So it sounds like that's really working. Thank you for sharing that. It's great to hear the positive experiences too. So thank you.
So I'm gonna move us along then. I know there's some great comments in but I'm looking at time and I want to make sure we get some time for the roundtable.
Thank you.
Today. So just bear with me. Let me get us to our next question here.
So I guess I'll defer to you all if you think it would be a better use of time for me to send out like a survey monkey where folks can respond more if they would like to, because I know that we've got a few more, or I have a few more questions that I'd like to ask. I could send out a survey monkey and then we could open up the rest of the time for a roundtable on what folks feel like they'd like to bring up, or we could continue to go through the remaining slides.
I think we can do both.
Mm-hmm. I agree.
Yeah, I think we can do both. So if you want to read the next question.
Sure. So what is the experience for incarcerated individuals, including adults in custody, as they release to the community while awaiting placement in a substance use treatment facility? So we're looking at where are they going? What kind of services are they receiving in the interim, or are they receiving services? Are they homeless or being placed in a hotel or with family and friends? I'm trying to get a temperature for what that looks like from what you all are observing. When they go into a homeless shelter, do you see them being supported with services during that interim period and making it successfully into a substance use disorder treatment facility, or do they sort of fall through the cracks once they step out of the jail? Okay. I'm seeing a pretty big disparity based on, almost seems like based on the region for what shelters or interim options exist. Can I ask where the group of officers that help gather up individuals that have fallen through the cracks, what region or county is that happening in? Thank you.
The theme I'm hearing, which is also in the questions box, is that if people aren't going straight into treatment, the likelihood of success there and really following through plummets.
Yeah,
And that's happening a lot. So
thank you for that. Okay.
Liliana, if you go to the next slide, oh, the next slide is also a poll everywhere, so it will change the poll question. Never mind.
Yeah.
Yep. Well, I do know that people will have an opportunity to add to this with the SurveyMonkey.
Yes. We're going to move on to the next question. And if you have more feedback, please put into the chat box. We will be capturing the chat box information as well.
What's the primary reason that prevents releasing individuals from entering a substance use treatment facility immediately upon release? Is it the substance use treatment availability? Maybe there's not an open facility or open staffed beds in the area. Is it the CCO enrollment and or an enrollment change that's preventing it? Or is it something altogether different that I can learn from you all?
I'm seeing a pretty strong answer here that is also verified, at least by our one answer in the questions box.
Okay. When we get to the roundtable, I would be interested to get your take on if the substance use treatment bed availability is new or exacerbated during the pandemic, or if it has always been a pain point.
Muted.
I'm gonna move us along. Again, you can type into the chat box.
So are there any jails or correctional facilities that are coordinating with a substance use disorder treatment program that you would hold up as a model for what's working well? Are there places where there are warm handoffs occurring between that, transition from a jail to a treatment facility, or where there's a gap in bed availability that, Multnomah County, where they're being cared for in the interim, safe housing, treatment? Wonderful. This information is so helpful. I really appreciate it. The question of, am I only referring to folks that are involved with the court? For the purpose of this conversation, I really am. But if you have insights, I certainly won't turn them down if there's something that you'd like to share.
I'm going to move us along to our next question.
Sure, this one should be pretty quick. Are you willing to participate in a follow-up survey to attain more information? I'm thinking that I would. Awesome, thank you. I'm thinking that I'll post these same questions. So if there's something that you'd like to elaborate on, or if somebody didn't get an opportunity to respond in the little window of time that we have, there's that opportunity. But then this is also, what I'm reading here is prompting some additional questions that I would love to get your insights on.
So I'm not seeing any no's.
Thank you very much.
All right.
Uh,
And we don't have that much time. We have about 10 minutes for roundtable. So what I would love to do is
Unmuted.
open it up to anyone that would like to provide feedback or elaborate on some of the feedback that they have, or any questions they may have to our wonderful policy team and the JI team here. So if you would like, I know Vixen wanted to say more, right, Diana?
Yes, and maybe I can either read it out or I can unmute Vixen.
I'll just unmute Vixen. If you could let us know a little bit more about some feedback that you wanted to provide. You're unmuted now.
Okay, so the biggest thing in Wallowa County is our inmates are arrested in Wallowa County. They are then shipped to Umatilla County, which is about 2.5, 3 hours away. We now have a relationship with the Umatilla County Jail. They have nobody in-house that is willing to help with the OHP process. So our issue there is once they're incarcerated, they no longer have OHP. So even if Center for Wellness and we find a facility for them, without showing current OHP status or insurance status, they aren't able to get on a list, and they aren't able to then leave the jail and go to treatment. So that leaves us a flag. The other issue we have is if they come back to Wallowa County and they have a lag in coverage, then our pharmacies won't cover them on open card either. They won't give them per prescription on open card. They will only fill prescriptions once they're assigned to the EOCCO. So that gives us another week or so in process time, because it takes a little while for the EOCCO to show them as active. So that's our little barriers we have here.
Okay. So for that second one, I'd like to kind of paraphrase back what I think I understand, and please tell me if I'm wrong. But what I think I'm hearing is when they return to Wallowa County, they have their OHP eligibility in place. They're on open card pending the CCO enrollment, but the local pharmacy won't fill on open card.
Correct. And they won't necessarily have their OHP. So if they're released on like a Friday or Saturday, they're not going to be able to get with me till like Monday, because I'm the only one that helps them here with that process. So if they are released, or even in evening releases, it could take a little bit for that, any OHP status to happen. And then we have been told that, so if they were released tomorrow, like on the 12th, they won't have coverage for the EOCCO till the 19th. They say it takes at least a week for the EOCCO to get them in there. And yes, our pharmacies will not give any prescriptions out on open card.
Okay. So I'll say I don't like it, but I understand the nuance of not doing a prescription unless they take cash before they have the Medicaid eligibility in place, because they don't have insurance, period, during that time frame, which is a problem, and we need to fix that. I guess I'm struggling with the concept that once their OHP is active, while they're on open card, that the pharmacies are not filling a prescription during that interim until they enter into EOCCO enrollment. Is that an experience that's happening elsewhere?
And then I'm gonna since you've been in the chat box, I'm gonna let you unmute people that may have other questions or comments.
Yeah, I'm trying to figure out I'm trying to understand some of the questions, and I'm also trying to listen at the same time. So Sorry, I'm trying to understand some of these questions.
So, is there any, if someone could raise their hand, is this happening, what Vixen explained about pharmacies and refilling prescriptions, is this happening in any other counties?
I see Melinda with your hand up. So Melinda, I'm going to unmute you so you can speak to that if that's what you're trying to speak to. You're
Hi.
unmuted.
Yeah. Hi. Can you hear me?
Mm-hmm.
Yeah. I work for Yamhill County, and I know that our pharmacies around here will not. If your card is not active, I know that open card they'll use it. That's not a problem. But if your card is not active and you have not seen one of us and gotten it taken care of, and it is on a weekend, you will have to pay cash, and then go back and resubmit the claim with them after you get your OHP taken care of. And I know that outside counties, because I have worked as an assistant for many years, that has happened through other counties that I've worked with. The pharmacies just refuse to allow them to have any kind of leniency. They want the money up front or they want the OHP. I swear we got a response, but I haven't looked at it.
Do you know if people are requesting an bill?
Going around this morning about her.
There's a lot of background noise in somebody's area, a background conversation. It's making it very difficult to hear, and I can't tell who it is. It might have been Melinda.
I was muted when she was talking, sorry. I'm unmuted now.
Okay, you know, people are requesting an emergency fill to get them through, or if they're just requesting the full prescription.
Usually they're I'll tell them to do like an emergency fill, and still the pharmacy will expect them to pay for that. And even when they ask them for the 3 pills for the emergency, because I've done an emergency fill before, waiting for my doctor to refill a prescription for me. They still expect them in Yamhill County. The pharmacy still expect them to pay for part of it, especially if they have no insurance. They're not lenient on it. The pharmacies around here are not lenient at all because they're expecting them to come in and either pay for the prescription or have the insurance. They're not lenient at all. Pharmacies do not care, and you either have money or you have an insurance with you.
So what I think I'm hearing, and it's actually really hard to listen through the background conversation.
Right now, so hopefully she's able to address that. You can just. I
think what I'm hearing in general is that getting medications for folks is challenging. There's this concept of an emergency fill that might be a future topic to discuss, but it sounds like it's working in some places and not in others. Really understanding what an emergency fill is and the rules around it might be for future discussion. And just medication access in general.
That sounds like a great topic for the next JI Collaborative. Thank you. And then do we have anyone else, Diana, that would like to give one last comment? We're about 2 minutes before the collaborative ends, and we just want to give, I want to give space to anyone else that would like to give feedback. If you want to raise your hand or type into the chat box that you want to be unmuted.
Yeah, I do know Alicia Morton had her hand up and my list of attendees has disappeared, so I'm trying to get it back. I don't know, there it is, it's hiding. So Alicia, I can unmute you, and right before I unmute you, I just want to say that there are also concerns about getting enrolled into a CCO in order to get coverage. but I want to remind people about, I think it was the last JI collaborative, about really outlining the rule that whatever coverage somebody has, whether it's fee for service or any CCO, that entity is responsible for the SUD treatment stay. And so please refer to the last webinar and reach out if you have more questions about it. Alicia, I'm going to unmute you. At least I'm trying. Oh, but you're self-muted, so if you can.
There. Am I good now?
Yep.
Yeah, really quickly, I have come across this where pharmacies are refusing to fill the prescription based on the open card. And what I have found is that it's really about their lack of understanding on how to bill open card. And I can't remember how I did it because I went down a rabbit hole, but I was able to connect with the pharmacy kind of specialist at OHA, and they explained it to me. And then they quite often will call that pharmacy directly to explain to them how to bill on open card, and then it's taken care of. So that's been my experience. And my other last comment really quick, is there any way in the future we can make these collaboratives longer so we do have more time for these really good discussions? That's it.
Thank you.
We can, we'll try to make these at least an hour and maybe 30 minutes, Diana?
Yeah, I love it. Let's try that.
We'll try it. And again, you all are, we do what you want. This is your collaborative, the JI Sisters Collaborative. So if you want more time, and definitely, I know how much the roundtable is value to having these dialogues and having people from a policy team and from the processing center JI team here. So in the future, we'll extend the call, and we're really grateful that you all provided all this amazing feedback. We're at time, so again, we want to remind you that the corrections email changed to Justice Involved 5509, as Beth mentioned earlier. Please make sure to add that to your contacts list, and we will be following up with an email with the slides. We want to thank you, like always, for participating in the Justice Involved Collaborative. We want to thank Katie for coming in as our guest speaker and giving us a wonderful presentation and the opportunity to hear from you all that are doing the work in community. Diana, do you want to mention anything else? And again, I want to thank so much our policy team and Beth and Greg for being here with us as well. Diana, anything else?
This will be recorded, and I think we can post this, and we got some great topics for next time. And what I also heard, and our provider coordinator, Jessica Diaz, is on this phone call. What I really heard is a desire for some support about how to communicate with pharmacies to make sure there isn't just a confusion about how to bill open card. So noted, and stay tuned.
Yeah, and I'm getting an ask to go back to this slide. So I'll keep it up for a couple more seconds. Again, I will be following up with an email. You will be getting the slides. Again, remember, it's Justice Involved 5509. That is the new email address. And thank you again so much thank you so much for being with us. If you have any other comments or anything you would like to share with us, please email Diana and I, and we're more than happy to relay that to Katie. Thank you so much. Talk to you all soon. Have a great rest of your day.
Bye-bye.
Thank you.
Thank you.